Dermatology. All right, I feel like I'm in the principal's office right now. I am a sun baby, and I haven't always treated my skin very well, but you're here to give us all the tips and tricks on how to take care of our skin with these warmer months ahead. Dermatologist, Dr. Jared Heaton, you are here from Legacy Dermatology. What do we do? Help me.
You know, the best thing you can really do is just be aware of your skin in the summer. I mean, you want to be careful using sunscreen that's going to be sufficient in its SPF, which we usually recommend, you know, in hotter climates or hotter times of year, you're using at least an SPF 50.
Okay, I wanted to ask you about that. Are there certain ingredients or certain sunscreens that maybe are better than others?
You know, we tend to prefer mineral-based sunscreens, which are zinc and titanium.
Make sure those are in it.
Yeah, zinc and titanium probably have the best protection out there. Chemical-based sunscreens are okay, but I would look for zinc or titanium, at least 8 to 10%.
Okay, and then there's a staggering fact I want you to talk about. The #1 state in the U.S. where people, what's the fact that people are at the highest risk for melanoma?
Melanoma is Utah, which
so
you would
bad.
never think that. I mean, you'd think it's Florida, it's Arizona, but just because we live at a high elevation climate, we have, you know, sand and sun and water and snow and all the reflective stuff, and we're a pretty outdoor population, so we're just at a higher risk.
Oh my gosh, that's so terrifying. May is also Melanoma Awareness Month.
It is.
And there are so many ways that we can protect our skin, like you said. What are a few tips that we can make sure to do, maybe even on an everyday basis as it gets warmer?
You know, if you're female, if you have SPF in your foundation, that's really helpful. You definitely want to seek shade on those warmer days, anywhere between the high sun exposure times of like 10 to 2, 10 to 4. And just stay covered up. Just don't let your skin burn.
Okay, so I went to college in Hawaii.
Yes.
I didn't wear much sunscreen. Did the tanning bed thing when I was younger. I mean, the tin foil, we didn't, I don't know if we didn't know or we didn't care. Is there anything we can do to counteract all that bad stuff?
Yeah, I mean, sadly, once the damage has been done, it's been done, right?
Okay,
But if you're
so
aware, yes, and I did the same thing. I mean, we hear that all the time. But really having good regular skin exams is important, especially if you had a lot of sun exposure, especially artificial sun exposure from tanning beds when you were younger. That's really important. And watching your moles, if you have moles that are actively changing and you see them, you know, within weeks to months, actively changing borders, colors, anything like that.
Make sure to get in and
They
get those
should be
checked
checked. Or a family history. If you have a strong family history of melanoma. Genetics plays an important role. You're at significantly higher risk for getting melanoma if, like, a brother, sister, or mom and dad has had melanoma.
And you mentioned to get regular checks. How often should we be doing this?
You know, usually once a year is fine, especially if you're in a higher risk category. So the family history, if you're blonde and blue or redhead or just have a fair complexion, or you've had that history of extensive sun exposure when you were younger.
Okay, get checked. And then again, this month we're all about awareness, and you have a special program going on where people can get their moles checked.
Yeah, the American Academy of Dermatology really kind of pushes this Spot Me program, and so a lot of dermatologists will do this in May during this Melanoma Awareness Month, where we'll offer some free skin cancer screening times. So no obligation, it's absolutely free to come in. We have a couple of days this month that we're doing that on the 14th and the 21st in the afternoon. So
perfect. And where can people find you if they want to get a hold of you?
Yeah, our social media, we're Legacy Derm. Our website is legacy-dermatology.com, and our phone number is 801-797-9121.
That was a test. You passed.
I passed. Good.
Enjoy the sun, but keep your skin safe. Thanks so much.
Appreciate it. Thank you.